Welcome to This Week in Health IT, where we discuss the news, information, and emerging thought with leaders from across the healthcare industry. This is episode number 38, and this week we have a special episode from the Becker's conference in Chicago, where I interviewed 6 different CIOs and asked them a series of 5 questions. Jason Joseph, the Spectrum Health CIO, Jake Dorst, Tahoe Forest, David Chow, CIO for Children's Mercy, Andrew Rosenberg, Michigan Medicine, Ed Marks, Cleveland Clinic, and Tom Barnett, the University of Rochester. It's so much content that we split it across 2 episodes. I'm going to release them both on Friday, so you have a lot to listen to this weekend. And we're going to start with Jason Joseph and then move to Ed Marks and then Tom Barnett. And in our next episode, we'll listen to Andrew Rosenberg and Jake Dorst. So without further ado, here we go. Jason Joseph, CIO, newly minted CIO for Spectrum Health. Give us an idea of Spectrum Health, scope, scale.
Sure. Spectrum Health is a integrated health system located in western Michigan. We serve primarily about the 13-county area surrounding Grand Rapids. We're growing and proposing an integration down in the southwestern part of the state with Lakeland. But we really cover a much broader scope of that from a patient population due to our children's hospital. So we have a children's hospital that covers the majority of the state and actually beyond the walls of the state on occasion. And then we have a health plan that has around 800,000 members and covers the state of Michigan completely. So we're a little bit unique in that our health plan and our delivery system are similar in size from a revenue perspective and do not have a full overlap. So we have patients who are members who are patients, but we also have members who are not patients under our care, and we have many patients who are not members.
So you're the CIO of the system and the health plan?
I am the system CIO, correct. So I have responsibility for information services across the board, which includes our hospitals, our medical group, our post-acute services, our health plan, and our other corporate entities as well.
Wow. Sounds like a lot. All right, so 5 quick questions. I asked Ed Marks these same questions. I'm going to ask a couple more people. So
great.
They're going to sound side by side, so people are going to...
You can compare and contrast or relative...
It's mostly just different approaches to the same question. So we'll start off pretty easy with the first question. How is your system thinking about digital or addressing digital in healthcare?
So we've been in the digital business for quite a while. We've been a leader. I think our initial patient portal dates back to 2008, if I'm not mistaken. So we're 10 years into the patient-facing digital tool set journey, and we've been in multiple iterations of that. Our digital approach has been that of providing digital services and integrated digital services to our patients and members in the way that they need them when they need them. We have a mobile-first strategy along with that, so everything that we do online we make sure is available in our mobile solution as well as in the other type of environments from an engagement perspective. But if I were to kind of zoom out and think about digital, I think of it in 3 categories. Digital used for patient acquisition, digital marketing, how do we understand and manage the consumer of healthcare? How do we do outreach? How do we communicate? Then there's a digital engagement, which is essentially, in my world, think back to the early days of Amazon, right? Amazon started selling books online, and it was the online services that got you there. It was still a paper book, but it was a new digital way of buying it. And I think our patient engagement, our member engagement services really highlight the ability to interact with our health system and get the type of thing done that you need. That's becoming more and more mainstream and more common. And then I think the really third area and the emerging area is around digital health. And that is actually converting the healthcare that we provide from an analog type of equivalent to a digital equivalent. And that can take the form of virtual, where you're removing the barrier of space between the patient and the provider. That can take the form of artificial intelligence, where we can take some of the low acuity things offline. It can take the form of really looking at the waste and the delays in healthcare and finding ways to automate or use advanced analytics and new technologies to get in the way of those things. And I think that's the area that you're going to see the most innovation in the years to come.
Yeah, digitizing healthcare is really interesting. It changes the access method as well as the data backend. One of the things I've been sharing with people is I just read Stephen Klasko, CEO of Jefferson, shared health system without a zip code is his 10-year vision. And digital plays such a key role in that, of access, delivery, and all sorts of things. It's just staggering to think what that might look like. Second question, how do you determine the noise from the value in the digital space? So you just finished speaking at the Becker's conference, and about 10 vendors surrounded you with their cards and whatnot. But so one of those might be awesome, and 9 of them might just be noise. How does your organization do that?
I think healthcare is in such an interesting time right now, and in order to separate the noise or the signal from the noise, you need to separate the strategy from the things that are opportunistic. Right. And as I think about it and look back, our core, our system just went through a big Epic implementation, as many have. And to leverage that investment, you have to understand the roadmap and the development that's going into some of your core platform vendors. And for my money, if it's anywhere near that core, that's our answer. And that's really the strategy that we're going to employ, is do not invent what you don't need to invent.
So you're encouraging people, if my EMR provider does this, go somewhere else.
If my EMR provider does this, I would tell people in the startup space this as well. If you're trying to compete and go after Epic clients with functionality or tools that Epic has or will be providing as part of their core in the future, you will not outrun that bear, and they will supersede your functionality at some point in the future. And the fact that it's all integrated is always going to trump whatever incremental functionality add. So not to be disparaging and say, don't innovate, but innovate in the right space. Innovate in those spaces that don't have a core adjacency to the stuff that we've all spent millions of dollars putting in and implementing, and we're now trying to optimize and get our value out of. Help us in those areas where you can add on top of the value and start to think of it differently. If you want to compete with Apple, you're Samsung, and that's probably 1 or 2 or 3 vendors in that space that are going to be successful. However, if you want to be an app developer on the App Store, there is a huge marketplace for you. Just recognize when you're on the platform and when you're actually selling an app.
Yeah, it's that's really fascinating. I work with a lot of startups, and they say, I don't understand why this health system doesn't buy my stuff. They need it. It's absolutely necessary. And I say, well, do you realize it will take them probably 18 months to implement it? Just from a contracting standpoint, it's going to be 6 months.
Contracting, implementation, change management, understanding the workflow integration points. And then you look at whether that problem is actually the biggest problem in the health system.
Right.
Maybe a problem, but it doesn't mean it's the biggest problem. And we all have finite resources in terms of money and time to spend on this stuff. And we've got to be judicious about how we do it.
Absolutely. So what's the biggest opportunities for health IT right now? You're talking to a whole bunch of CIOs potentially. What's the biggest opportunity that you see out there?
Yeah, I think you could answer that question in two fronts. One, I think that we have a huge opportunity to leverage some of our core infrastructure and simplify it so that we are more digital ready. I'm a big believer in having a few core systems that you really invest heavily in, but the pace of change is such in our business that you're still going to need to adapt, and you're going to need to flex into those strategic opportunities. And it's incredibly hard to do that if you've got complexity under the hood. And so I would say do not underestimate how much that complexity will hurt you in the long run if you're not ruthless in rooting it out. Simplify. Not only for the cost, but also for the agility that it's going to provide you. And so that's kind of philosophically, I would say, our opportunity is to get more simple so that we can be more agile, so that we can innovate. And I think the innovation is going to come in 2 main areas. You've already touched on them: digital, and how we transform our healthcare systems digitally, some of which will be very common types of capabilities that we're all going to have in our toolbox. And then there's going to be those things that are truly differentiating. And the second is how well we use the data that we actually have in our systems to come up with new answers and new outcomes. And that's where our business and our clinical competitive advantage is going to come in with advanced analytics and some of these tools. If we can apply those well, we will actually see significant changes in the core of business of healthcare. There's other things that we do every day that just helps us kind of make the core a little better. The things that I look for are the things that actually change the core. The things that say you no longer need that diagnostic process. I'm looking forward to a point in time, and this may be way out there, where you could actually go in and have some medical imaging done, and when you walk out, you're going to get a report because it's so protocolized and the AI engine has become so strong that you're going to get a 99.6% accurate report out. Same thing with low acuity primary care. So the engines, the intelligence, the machine learning is going to quickly make it so that these are realities in the near future, and we have to be ready to capitalize on it.
So this is me cheating, but in your session, you talked about the build versus buy sort of. We're going to invent new analytics versus we're going to buy new analytics, and it's interesting in this space how much, if you sort of to put a percentage on it, is it 80-20, 90-10? I mean, how much are you actually going to build because you have to, because you need to differentiate?
Yeah. I think right now it's going to be closer to 90-10 we're going to buy. And I think as you get better at it, you're going to build more because you're going to have the tools. And
right, once the platforms are in place, that you're not really building the platform, you're just customizing on top.
Yeah, and so where I would say our build is going to come in is our understanding of tweaking the algorithms that we have, understanding and tweaking how the data fills into theirs. But from a platform perspective, you can't have a analytical platform that you build yourself and then have a strategy to leverage your core common vendors. It's incongruent.
Right.
And so our strategy is going to be to leverage the core to the fullest extent, buy what's available in terms of reports, dashboards, algorithms, and focus on getting those to actually materially improve our business, whether that's clinical outcomes, financial outcomes, whatever it may be. And then as we get good at doing that, understanding what it will take for us to actually innovate in that space, leveraging the same platforms, but innovating in that space and actually creating something unique that we may have the ability to do.
All right, I'll get back on script.
Sure.
So what's the biggest threat to traditional healthcare system today, internal or external?
I think it's a boiling frog complacency. All health systems are going through some form of, hey, our volume's not going down, but we're not seeing the same level of reimbursements at the same thing. And we're all trying to figure out how value type engagements play into our business plans and our business models. And in the meantime, you've got disruptors coming in saying, hey, we're going to buy a population and we're going to do healthcare differently. And when you look at the pool of money available in healthcare, this is the thing that fascinates me the most, is we look at it and we say we spend way too much money on healthcare, yet we think there's so much money to be made in healthcare. It doesn't seem like there is. The way you make money is to actually reduce the cost. So the only money-making opportunities are going to be things that are truly revolutionizing the care process and moving it out. I think the systems that aren't seeing that and that are just trying to optimize the business that exists today are at risk of having something blow in that they can't keep pace with. I'm personally not as worried about the things that are kind of flash in the pan. Hey, this is cool, and you're going to get it. A new video visit or that kind of stuff. I think we're well positioned to still compete there, and there's still time to do it. I do worry a little bit about shifting the eyeballs of the consumer, owning that relationship, and then taking away the things that do pay the bills for the health system in favor of the things that don't, and not addressing that disparity. It's going to leave us all in a really rotten position if we don't.
Yeah, that's the challenge, is you have one foot in each boat, and you're saying, okay, we're going to disrupt our current business, but when we disrupt our current business, our revenues come down, therefore our bond rating comes down, therefore our cost of debt goes up. It's like you're reinventing as you're maintaining.
There's a very narrow path to walk to get from here to there. And there's, history is riddled with examples of businesses that did not do this well. Everybody has the Kodak moment in their mind about how do you actually go there. And that's, I think, the challenge for healthcare, is making sure that you're both cognizant of the financial realities we live in today, but starting to shift to take advantage of the financial realities of tomorrow. And if you're doing that well, you'll be successful. If you get off track one way or the other, it's going to hurt.
Crazy. Last question. If you new CIO, you're the second new CIO. So I talked to Ed Marks last night, and he's only a year into it. So this question's kind of interesting. But if you could rewind the clock 3 years, what do you wish you had done 3 years ago to really prepare your IT organization for today?
I think we have a tremendous, talented organization, especially in West Michigan. I mean, we've got great access to schools. We have a strong internship program. We really have very, very strong teams. If I had to rewind the clock, I would say that we could have done even more to develop leadership talent. Tech talent, leadership talent, and moving people along very prescriptively to make sure that we always have a next layer of leaders ready to go across our organization is going to challenge all of us. I mean, the demographics are changing. You're seeing leaders retire and move on at a more rapid pace. And it's going to be incumbent on all of us to make sure that we're not only stepping into that void, but we're preparing the next layer of leaders. And so I think that you can't spend enough time really thinking through how do we develop a high talent, impactful organization. And within IT, you've got to have the technical chops, you've got to have your IT talent, but there's so much more that is going to be needed for that in the future in terms of business acumen, communication skills, strategic thinking. We got to start now, and I wish I would have started even sooner, placing more emphasis on that than we have.
Well, yeah. Thanks. I will have to have you on a full show because we could talk for another half hour on some of these things. So,
yeah,
thanks for your time.
So.